Good day everyone. Today we are having our computer-aided learning experiments on the pharmacological approach for the respiratory system. Due to the complexity and the limitation, the experiments for this course are conducted virtually. You are required to go through the presentation to fully understand the experiments. Hands out of the experiment would be covering the anatomical structures of the respiratory systems, the afferent and efferent nerves, the transmitters and their receptors, the substances having a direct and indirect effect on bronchial smooth muscle, the pathophysiology of the airways, and the pharmacological approaches. Good day everyone. Upon completion, the student shall be able to 1. Describe the mechanism of action and number of pharmacological agents on the lung function and 2. Explain the method. In this experiment, 400 to 600 grams of guinea pig were used. The animals were anesthetized and given a neuromuscular blocking agent. The anesthesia is achieved with a mixture of pentobarbital 30 mg per kg and phenobarbital 100 mg per kg given intraperitoneally. A neuromuscular blocking agent, golamine, 10 mg per kg is also administered intramuscularly. Body temperature is monitored via a rectal probe and maintained at 38 degrees Celsius by a heated blanket. Tracheostomy tube. The trachea is cannulated to allow oxygen ventilation at 1 Hz and 8 ml per kg and to measure the tracheal airflow pressure. Tracheostomy is performed between the second and third cartilage rings from the larynx and polyethylene cannula is inserted. Animals are ventilated with room air. The carotid cannula. The left carotid artery is cannulated to monitor blood pressure, providing an indicator of the animal's general well-being and to look for any systemic effects a drug may possess. The blood pressure transducer. Arterial blood pressure is measured by a transducer connected to a saline-filled cannula which is inserted into the carotid artery. The pulmonary monitoring system. Signals for airflow, transpulmonary pressure, and arterial blood pressure are amplified and fed via an analyzer to a digital converter and to a personal computer. Lung resistance and dynamic compliance are calculated by using pulmonary monitoring system dual software. The experimental protocol for measuring pulmonary function. This program uses data from actual experiments recorded using a digital electronic PMS to monitor tracheal airflow and transpulmonary pressure. The pneumotachograph measures the tracheal airflow and whereas TPP transducer measures the transpulmonary pressure. Experimental protocol. Bomazine experiments. In order to study the effects of bronchodilator drugs, the animal is treated with bomazine which produces a protracted bronchoconstriction. Bronchodilators will then relax bronchial smooth muscle and cause a decrease in airway resistance. Vagal nerve stimulation. In some experiments, the vagus is electrically stimulated by laying it over platinum electrodes and stimulating at 5 volt, 10 Hz, or 100 Hz, 5 milliseconds duration for 30 seconds. Allergic immunized animals. Some experiments were performed on guinea pigs which had to be sensitized to allergen by immunization with ovalbumin, given 21 days before. They were then prepared in the same way as the normal animals. The sensitization of guinea pigs attempts to reproduce the production of allergen-specific immunoglobulins seen in atopic subjects with asthma, providing a model whereby anti-allergic drugs can be investigated. Results of the experiments. Normal guinea pig. For normal guinea pigs, the animals were subjected to vehicle, bronchoconstrictors, and bronchodilators. For vehicle, the respiratory resistance and compliance did not show any changes before and after the administration. However, slight drop of blood pressure was noticed after 30 seconds of vehicle administration before the blood pressure normalized. For bronchoconstrictors groups, the animal were subjected to numbers of bronchoconstrictors, namely histamine, acetylcholine, bradykinin and vagal stimulation. For histamine group, the animals were subjected with series concentration of histamine with meperamine, indomethacin, and propranolol respectively. At 0.32 microgram per kg, no noticeable changes of lung resistance, lung compliance, and blood pressure. At 1.8 microgram per kg of histamine concentration causes significant increase in lung resistance, reduced in respiratory compliance and slight increase in blood pressure for the first 30 seconds of administration. At 5.6 microgram per kg, the effect of histamine on respiratory resistance and blood pressure increases significantly, while the lung compliance drops significantly compared to the animal received 1.8 microgram per kg of histamine. Administration of 1.8 microgram per kg of histamine and 1 mg per kg of meperamine was also studied. Administration of meperamine prior to the administration of histamine do not cause any changes to the monitored respiratory parameters. In this experiment, the effect of indomethacin and histamine was also studied. Administration of 1 mg per kg of indomethacin alone have no effect towards lung resistance, compliance, and blood pressure. However, the administration of histamine after the administration of indomethacin increased the lung resistance and significantly reduced the lung compliance and blood pressure compared to that observed with 1.8 microgram per kg of histamine alone. Effects of histamine on the parameters observed were amplified with the administration of 100 microgram per kg of propranolol. The animals were also subjected to series of acetylcholine concentrations. At 3.2 microgram per kg, acetylcholine have no, or little effect towards lung resistance and compliance. However, there was noticeable decrease in blood pressure 30 seconds after administration of acetylcholine. At 5.6 microgram per kg, acetylcholine increases the lung resistance. It also reduces the lung compliance and lower the blood pressure. The effect of acetylcholine increases significantly at 10 microgram per kg. Administration of atropine at 1 mg per kg alone have no effect towards lung resistance, lung compliance, and blood pressure. Administration of acetylcholine after the administration of atropine have no noticeable effect towards lung resistance, lung compliance, and blood pressure. However, administration of indomethacin and propranolol prior to the administration of acetylcholine increases the lung resistance. Whereas lung compliance and blood pressure drops significantly low compared to the effect of acetylcholine alone. The effect of bradykinin was also studied. At 0.1 microgram per kg, bradykinin have no, or little effect toward the lung resistance, lung compliance, and blood pressure. However, bradykinin at higher dose increases the lung resistance and blood pressure while reducing the lung compliance. There were no lung resistance, lung compliance, and blood pressure changes observed after the administration of indomethacin prior to the administration of bradykinin. For vagal stimulation, the animals were subjected to low and high electrical frequency stimulation, 5 volts, 10 Hz, and 5 volts, 100 Hz respectively. At low frequency, the lung resistance increases, whereas the lung compliance and blood pressure decrease. The condition further exacerbate at high frequency. The administration of atropine prior to the low and high frequency stimulation reduce the effect of vagal stimulation towards the parameters observed. The animals were also subjected to bronchodilators. The animals which received 300 nanogram per kg bomazine increase the lung resistance, reduce the lung compliance and with slight increase in blood pressure. Administration of epinephrine post-administration of bomazine, reduces the effect of bomazine towards the parameters observed. Administration of meperamine post-administration of bomazine have no, or little effect on the parameters observed post-administration bomazine. In this study, the allergic guinea pig were subjected to histamine plus meperamine, LTC4 plus meperamine and antigen plus meperamine. For histamine plus meperamine group, administration of histamine alone, causes the lung resistance and blood pressure to increase, whereas lung compliance drops significantly. However, the effects of histamine was not observed pre-administration with meperamine. In the LTC4 plus meperamine group, the animals were subjected to LTC4, meperamine and montelukast. Administration of LTC4 alone causes the lung resistance to increase, drop in lung compliance and blood pressure. The administration of meperamine does not interfere with the lung physiology or the mechanism of action for LTC4. Administration of montelukast alone has no effect towards the lung physiology. However, it reduces the effect of LTC4. For antigen plus meperamine group, the animal were subjected to antigen and meperamine, with or without montelukast. Animal received ovalbumin alone have high lung resistance, low compliance, and low blood pressure. When exposed to ovalbumin after the administration of meperamine, the effects of were not as severe compared to being exposed to ovalbumin alone. Exposure to meperamine and montelukast prior exposure to antigen reduces the effect of the antigen alone towards the lung physiology. You are required to write a 1000 words report on the CAL which consists of result, discussion, and conclusion. It is an individual assignment. You have 1 week to submit the report through Turnitin, link will be provided later. Assignment with plagiarism more than 20% will be rejected. Thank you and stay safe. Good luck.